Hi, this is Nirupama Chatterjee. I'm with my channel Health LS, and today I'll be discussing on a topic migraine, which is a concern for those people who are suffering from migraine. So, to start with, what is migraine? Migraine is that pounding, pulsating feel of pain on one side of head, which can last for hours and days with nausea, vomiting, and irritability. Now, pain or discomfort also is there from the sensation of light, which is called photophobia, and then sounds, which is called phonophobia, and smells even, which is called osmophobia. Now, migraine is actually a type of headache characterized by recurrent attacks of moderate or severe throbbing and pulsating pain on one side of the head. This pain is caused by activation of nerve fibers. Untreated attacks last from 4 to 72 hours. Other common symptoms include increased sensitivity to light, noise, and odors, which are actually called sensory stimuli. Nausea can be there with vomiting also. Now, what are the triggers and causes of migraine? The triggers can be as simple as caffeine, then alcohol, chocolates, menstrual periods, stress, lack of sleep, or even barometric changes. By barometric changes, what is meant is the change in pressure in the outside atmosphere. Then the causes can be brain injury, gastrointestinal factors, inflammation, liver imbalances, cardiovascular parameters, menopausal symptoms, then hormonal imbalances, and metal imbalances also. Now, 1 billion people worldwide suffer from migraine, and more than 50% of those migraine sufferers are undiagnosed. The exact cause of migraine is unknown, though they are thought to be the result of abnormal brain activity temporarily affecting nerve signals, chemicals, and blood vessels in the brain. Around half of the people who experience migraines have a close relative with the condition. This suggests that genes may play a role in migraine. A number of different factors can trigger or increase your risk of having a migraine. These factors which trigger the headaches process vary from person to person and include sudden changes in weather or environment, too much or not enough sleep, strong odors or fumes, emotion, stress, over exertion, loud or sudden noises, motion sickness, low blood sugar. Factors which can increase risk of having a migraine are skipped meals, tobacco, depression, anxiety, head trauma, hangover, some medications like oral contraceptives or vasodilators, etc., hormonal changes, bright or flashing lights, as I said or mentioned, that is photophobia. Now, foods can also be a trigger, like aged cheeses and salty and processed foods might trigger a migraine attack. Even food additives can be a migraine trigger. These include the sweetener aspartame and the preservative monosodium glutamate found in many foods. Now, there are two major types of migraine, which are number one, migraine with aura, previously called classic migraine. Now, migraine with aura or classic migraine includes visual disturbances and other neurological symptoms that appear about 10 to 60 minutes before the actual headache and actually last no more than an hour. Individuals may temporarily lose part or all of their vision. The aura may occur without headache pain, which can strike at any time. Other classic symptoms include trouble in speaking, an abnormal sensation, numbness or muscle weakness on one side of the body, a tingling sensation in the hands or face and confusion, nausea, loss of appetite, and increased sensitivity to light, sound, or noise may precede the headache. The other type of migraine, that is migraine without aura, or which is commonly known as common migraine. Now, common migraine is a more frequent form of migraine. Symptoms include headache, pain that occur without warning and is usually felt on one side of the head, along with nausea, confusion, blurred vision, mood changes, fatigue, and increased sensitivity to light, sound, or noise. The do's and don'ts, certain things which can do or which you should not do to manage your migraine appropriately. Now, what to do? Sleep smart. Sleep is a tricky trigger. Why tricky trigger? Because too much of sleep or too little of it can bring on a migraine. So it is indeed a tricky trigger. The key to keep your downtime constant. Figure out your sleep schedule, sweet spot, and stick with it. What you should not do: skip meals. When your blood sugar drops because of skip meals, your brain feels it first. Hunger is a common cause of headaches. Be sure you are giving your body the fuel it needs to work all the day. What should you do? Watch the caffeine. This pick me up is both a trigger and a treatment for migraine. That means caffeine can be a trigger or can be a treatment for migraine. Either way, some headaches meds add caffeine because it boosts the effectiveness of the pain relievers. The problem comes when you have too much of it. You could set yourself up for a rebound headache or so be careful with caffeine. Don't over or underdo exercise. Sometimes too much exercise can spark a migraine, but regular moderate activity will give you overall health a boost and help you stay headache free. Remember to start slowly and increase your activity level gradually. Now, what are the other thing you should do? You should watch the weather. Storms often come with changes in atmospheric pressure. That is the barometric pressure. These shifts can be a dozy on your head, so don't get caught off guard. Check the forecast often so you can have treatment on hand if you need it at all. Now, what you should not do: don't dry out. Even mild dehydration can spell trouble if you get migraines often. Give yourself a goal of 8 glasses of water a day to keep the head pain away. Limit caffeine containing and alcoholic beverages since they can dehydrate you. Now, what you should do, that is plan your period. Hormones can wreak havoc on your head. It's common to get migraines with your period, that is menstrual period. Some women get them when they ovulate and during menopause too. Have a pain relief plan in place when you know your hormones will be in flux. Don't stare at screen for a longer period of time. Hours in front of a computer or TV can strain your eyes. For some people with migraine, eye strain can trigger head pain. Take breaks often, stretch, close your eyes, and get up to get your blood circulating or flowing. That's all, or that will help stop a migraine before it starts. That's very important also. What you should do: track your attacks. You can't avoid your triggers if you don't know what they are. Keep a migraine diary and write down what you eat, your sleep patterns, medications you take, and any symptoms you have. This will help your doctor come up with a prevention and treatment plan too. What you should not do: grit your teeth. Teeth grinding and jaw clenching are common migraine triggers. If you are doing it in your sleep, talk to your dentist about a device that helps hold your jaw in place and prevent problems. If daytime grinding gives you pain, try to pinpoint the source of stress and work to lower it. What you should do: de-stress. Constant worry and tension can harm your health. If you are migraine prone, your stress can bring one on. You may even get them after your stress is over and you are ready to relax. Exercise, eat right, and get enough sleep to help lower your stress level. You may also find counseling, biofeedback, or even medications can bring more calm to your life. What you should not do, that is, don't ignore your environment. From loud sounds to certain smells to flashing lights, migraine triggers are everywhere. Know what things set off your headaches and do your best to avoid them. That is important because then you can preempt any migraine attack. What you should do, be wary of wine. Alcohol is supposed to relax you, right? But for some people, the opposite can happen. Certain ingredients in drinks like red wine may cause headaches instead. Watch for a reaction when you drink. You may be able to have a glass from time to time, or you may need to avoid booze altogether. What you should not do, you should not smoke. There is no doubt about it. Smoking is not good for you. But if you deal with frequent migraines, lighting up can be especially harmful. Nicotine, the smell of burning tobacco, and secondhand smoke are all migraine triggers. Talk to your doctor about treatments that can help you quit. What you should do? Treat your body like a temple finally. The best thing you can do to prevent migraines is to take really good care of your health. Feed yourself nutritious food, drink water, move your body every day, and get regular sleep. If you focus on your health, your head will thank you. Now, as far as today is concerned, this is the first part of migraine because it's a long subject and it's overwhelming. Therefore, I don't want to, or I didn't want to, linger the presentation. So what I'll do is in part 2, we'll explore top self-care techniques for migraine, which is very interesting, how you can, prevent or manage your migraine and how to help yourself in migraine and certain myths about migraine. Thanks for watching. Hope this educational info is useful to you. For more such informative, relevant, useful, helpful, practical medical tips for you, your near and dear ones, please subscribe to the channel. On the bottom right hand corner of your screen, you will find the subscribe button. Please click to subscribe if you have not subscribed yet. And laughter is the best medicine, as I always say. So today's laughter dose, here comes. Yes, sometimes we deal with problems that don't even exist. Thank you for watching and see you tomorrow with my second part of migraine. Till then, thank you. Goodbye.